Good morning, it's Mayor Turner. I was just wanting to give you the latest numbers that we got. Talk a little bit about yesterday. We had a very good meeting. A lot of people spoke against the mandate. So at this time, council has decided that they're not going to do it. They voted it down. I know the city of Lubbock and the city of San Angelo have already implemented mask ordinances. So we may talk about that at another time, but I want to get you caught up on what's going on in Ector County. Let me start with the numbers like I do for with everything else. Amarillo is at 3746. Lubbock is having some issues. I think they're having some issues with younger people in bars. He has closed down one of the bars in Lubbock. What they're doing is if a bar wasn't following the directions of the governor, they went in and took their liquor license away for 30 days. A lot of people have asked, with the governor's new mandate, are the police officers going to be looking into whether a bar is social distancing and things like that? Because some bars are just choosing to open back up. In fact, I think we have a protest going on downtown. We will not be handling that. The TABC will be out. That's just the way it's going with what the governor's been doing. But, I'm sure the TABC will be out and visit some of the bars that are open. I feel sorry for some of these business owners that we've had to close again. But that is just due to the numbers that we're seeing on a state level. Lubbock is at 1984. Abilene is at 953. San Angelo is at 268. Midland is at 563. And as of yesterday, we have 900 cases. We will probably pass Abilene next on Wednesday, tomorrow, when we get the numbers again. We are seeing a surge in Ector County. We are seeing it in the hospitals. We had the first of our free testing that the city is using some of the CARES money for. We had 450 people show up for 200 tests. Shows you kind of the concern in the city that we're hearing about now. We're seeing one thing that we are trying to do is get more tests to be able to test more people when the fire department goes out. So we are working on that, and I'll talk about that here in just a little bit. We have had one more death. I need to find out and confirm it. But from what I was told, it was a 31-year-old young man has died of COVID. I believe I know who he is. It's very sad because he has talked to council. If it's the young man, I believe it is. And council was very impressed, a young man that was trying to start a business downtown. Right now we have 331 recovering. Talk a little bit about the hospitals. Medical Center has 23 in-house. They have 0 under investigation. Pending, they have 6. Right now, Odessa Regional Hospital has 13, and all 13 are in ICU. So we need to keep them in our prayers. COVID is really starting to get into our nursing homes. And I want to just read this. This is a report I got yesterday. The Courtyard Assisted Living Facility has 1 resident that has tested positive. Madison Medical Resort has 2 staff members and 2 residents that have tested positive. Buena Vista Nursing and Rehab has 1 staff member that has tested positive. Focus Care in Odessa is still having a lot of trouble. They have 18 total cases, 14 are residents, and 4 are staff members. Sienna Nursing Home has 4 total cases, and those 4 are staff members. Deering Nursing Home has 1 total case. Parks Living have 1 case, and 14 people tested, and those were negative. So we do need to keep them in our thoughts and our prayers because these people are very, very susceptible to COVID. So I want to talk a little bit about the hospitals. And a lot of people have said, well, maybe the census at the hospital is not that high. Let me tell you, the biggest concern we have right now with the hospitals is staffing. We've had a nursing shortage for the last 10 years. The entire state of Texas has had a nursing shortage. The U.S. has a nursing shortage. There were some people that were laid off, and some of those were administrative, some were other positions. But as the COVID numbers start to rise, there may be beds, but there may not be people, nurses, LVNs, people that draw your blood, people like that. That's the biggest concern we have right now. And one of the things that we are seeing, excuse me, is you find somebody who's positive for COVID and they cannot go back to their nursing home because they have to have 2 negative tests. Well, what does that mean? That means they have to stay in the hospital because many of these people can't take care of themselves. If they're in a nursing home, typically that's where they go to have somebody help take care of them. So what that means is that takes nurses away from people that are ill until those 2 patients have to get 2 tests. Typically, they have to wait 3 or 4 days between the test. And testing right now is going to become another problem here in Odessa. So that is one of the reasons that we are very concerned about the numbers. Dr. Saravan and Medical Center both said they feel right now they're at about a 75% surge. They have plenty of room. They have more rooms. They just don't have the nurses. And that's the concern, especially with the 13 patients at ORMC that are all in ICU. We do have some people in Ector County in Medical Center. One is from Big Bend. Alpine is having some problems with COVID down there. We also have one from Ward County. I believe the one from Ward County was actually somebody who stayed at home and got to the point to where Ward County Hospital couldn't take care of them and they needed to send them. Want to talk a little bit about CPL. CPL is the lab that all of Ector County has been using. What it is excuse me, the hospitals get the test kits, which basically is just a swab. They swab somebody, they put it in the test tube, send it to CDL or CPL, and they run the process to be able to figure out if somebody has COVID. The problem is CPL is inundated and has more tests than they can process. So they are going to not accept any test for the next 10 days. What that means is you could go down and get a test, but it's going to be at least 10 days before you get your answer back, which is very concerning, especially for our hospitals. The CPL said the only ones they will accept are critical patients. The hospitals do have the rapid test, but those typically are very difficult to get the cartridges. Like we've explained before, the cartridges, these test machines are a lot like a printer. You have to put the cartridge in to be able to get the test results. A cartridge will process, under 30 tests. And so the state is allocating some, and the manufacturing process from these vendors are also dictating not being able to get a lot of test kits or the test cartridges. So that is definitely a concern. Like I told you earlier this morning, we had our first of 8 free testing that the city has set up using the CARES Act. This was some money that the federal government sent out to the cities to be able to help them, one, get reimbursed for everything that they're having to deal with as far as COVID. A lot of overtime with our fire department, things like that. So we had allocated $750,000 for testing for our citizens. The Chief White, Chief Huber, all of those showed up along with help from Texas Tech and Medical Center. and UTBB to start testing, and we had 450 people show up for 200 tests. And they can't do any more tests because they don't have any more of the test kits. So there will be another testing on Thursday. I believe it will be at, no, it's on the south side. It's the park, and the park just left me. It's the big park over in the south side of Odessa. So if you need that test, let me give you just a couple of criteria so that we can maybe save you the effort. If you have been exposed to COVID, do not run out and get a test as soon as you're exposed. It's like anything else. If you're exposed to the flu or you're exposed to strep throat, it takes some time before there's enough virus in your system to be detected. So if you run out the first or second day after you've been exposed, your test is going to be negative because there's not enough virus in your system to be tested for positive. You need to wait 7 to 10 days. I know it's a long time. Unfortunately, it's what the doctors are telling us with this virus. So wait 7 to 10 days, or if you start having symptoms, the symptoms you can see on the CDC website. This virus is a little different. I know people that were having symptoms of a cold or maybe symptoms of flu, and all of a sudden they can't smell, or all of a sudden they can't taste. And so those are some of the symptoms of COVID. And that's when you need to go get tested, is when you start having symptoms. Because we want to make sure all of these tests are being used for people that are symptomatic or having, the headaches or having the sore throats or coughing or things like that. That's what we want to use these tests for. And especially at a time when we see the numbers rising and we are limited on the amount of tests. Both hospitals, Chief White, Chief Huber, are all working on finding us another source to be able to get these swabs tested. So we are working on that, and I will keep you up. As soon as I hear something, I will get on Facebook and tell you. But that's what we're concerned with. The young man that I believe passed away, it's sad because he was so young at 31. I'm in my 50s now. That's a lot younger. But, unfortunately, this disease is going to take some of our older people. I don't want to see it taking younger people. So one of the things we're doing as a council with the help of the chamber is, we're one of the biggest rise in the number of people we're seeing are 20 to 29s. We had a bachelor party. A group from Odessa went to Austin, went to the bars, caught it, and came back with it. We had some others, went to one of the rivers and floated the rivers, had a good time, came back, they had it. So we are seeing it now at all ages. It scares me a little more when we see someone who's young that passed away. But we are going to come up with a focus group of people from 20 to 29. We're going to do it all via Zoom to be able to talk to them and say, okay, we know you don't watch TV. We know you don't listen to the radio. What is going to be the best way for us to get a message out to each and every one of you, to be able to make you think about, maybe if you get it and you're 20, you're not going to have a few symptoms. But if you give it to your grandmother, you maybe give it to an uncle or someone who has had cancer, it could really be detrimental to anyone who has that type of problems. Many of what we've seen are the people that pass away. One, it's their age. Maybe it's they're obese. Maybe it's the diabetic. Maybe they've had cancer. Maybe they have cancer, and things like that. So that's what we're working on. I am a little concerned, especially if you are Hispanic. We are seeing, the last census told us that we have about 61% Hispanic in Ector County. Unfortunately, 75% of the tests that we're running or the positives are Hispanic. And we're seeing a small uptick in the African Americans. Why? We're not real sure yet. They haven't found anything medically that says this is why. So I have to think it has to be something that's cultural. maybe larger family gatherings, maybe, times for quinceañeras, things like that. I'm not sure, but that is something I want everyone to know about, and let you know what's going on there. This is a tough time. I think we will be over 1,000 by the end of the week. I've told you I would be honest with you here. One of my big concerns is the state of Texas. We have seen them come in. They went into Abilene when it got into one of their factories. We've seen it in Amarillo when they went in there. We've seen it in El Paso when El Paso's numbers started rising. I've heard that they are in Lubbock. I have not had that confirmed yet, but I don't want the state in here. I want the people of West Texas to be able to handle this, but we're going to have to find a way to take care of this, because this is really, I fear coronavirus. I'm more worried about economics. If we do not have people out there working, if we're having to close bars, if we're having to close the amount of people that can go into restaurants, yes, it hurts the business owner, but it also hurts those employees that can't go to work because they don't need as many employees. I had lunch yesterday with a friend. If I told you the restaurant, every one of you would recognize it. He said, if it keeps going like this, I've got about 3 weeks left. And that is concerning. Businesses that have been here for a long time, he said, well, I was talking to him, he said, we can't close back down. And that's something I'm not willing to do. I'm not going to close Odessa back down. We have to find ways to continue to do what we're doing, but get the numbers down. It really concerns me with the schools. The schools have been working diligently, all three schools, OC, UTPB, and of course ECISD, have been working on plans to get back into the classrooms. Those are on hold right now because our numbers are going up. And that's the scary part. You want those people in there. You want the janitors working. You want the bus drivers working. You want all those, because we're at 16.5% unemployment, which is the third highest in the state. That's not a number I want to hear. I don't want to hear we're number 3. If we're number 3, I want it to be something positive, not unemployment. And we need to get these people to work. So it may mean we revisit the mask mandate. Angelo and Abilene have both put those in there. And so we need to be diligent. I just want to thank you. I will be back on tomorrow. Right now with the numbers we are getting, Ector County Health Department is having trouble processing all the information. So I will be on when I get the numbers, just because that's what we're all watching, and I will keep you up to date on the testing, because that's going to be the key going forward. That's the 800-pound gorilla in the room right now that we need to take care of. So thank you, and God bless each and every one of you. God bless Odessa, God bless Texas, and God bless USA. Thank you, and please be safe.